Lord, be able to come to us in such a way that we'll be educated and we will understand clearly what is being presented to us. We thank you, Lord God, for Sister Kim Morris, who organized this event. And we ask, oh God, that you'll continue to bless her. We invite your presence to be with us, oh God. And we ask you just to help everyone who has joined this evening, that whatsoever is presented to them will be beneficial and we will all learn and be educated. Thank you for this occasion, and we look to you and give you thanks and praise. In Jesus' name we pray. Amen.
Thank you, Deacon Linda, for praying. Well, this month is celebrated as Autism Awareness Month. So here we are this afternoon to educate ourselves on this relevant topic of autism, which is otherwise known as ASD. Now, as we go around, we see these autistic persons all around us. We see the adults, autistic children. We see them all around us in the home, in the school, in the workplaces, on the buses, and just about everywhere we see these people. So here we are with us this evening, a team of educators headed by missionary Kimberly Morris, who will head the team. And these educators are here this evening to help us to dispel some of the myths and the misconception regarding the illness, so that as a people we can better able to appreciate the uniqueness of these individuals with autism. So I am inviting you to sit, listen keenly, and answer questions, ask your questions. And I know these educators are quite capable to answer. So at this time, I'm going to invite Deacon Lindo to come and greet us and acknowledge those who are here. Come back, Deacon, it's here now.
My person is to mute, please.
Yes.
Praise the Lord. Please unmute yourself, sir.
Deacon Linda, you're muted.
You hear me now?
Yes, sir.
Okay, thank you very much. Good afternoon, good evening, everyone. We are very happy to be here this evening for this seminar, our presentation as it's being titled. We are happy so far for the people who have joined. We see a very large number already, and we know you're all ready and rearing to hear from these presenters. A good team has been arranged, and they are very knowledgeable in this subject area. And so I know that we will be having good information on the topic, which will be useful to us. I just want to welcome everyone to this forum. I especially want to welcome our presenters, first of all. Sister Kimberly Morris, special educator and lecturer, will be moderating for us. Miss Soyini Williamson, special educator, she'll be a speaker. Miss Israel Harrison, Miss Jamaica International, Jamaica 2022. She'll be speaking as well. And Dr. Shawana Miller, school psychologist, and Mrs. Zoa Knight Samuels, special educator. Want to welcome our ministers, our elders, want to welcome our bishop, all our brethren, and those from schools, teachers, parents, everyone. Welcome. And I trust that we will all benefit from this session. At this time, I'll just be asking our Bishop, Otto, to bring greetings to us. Over to you, Bishop Otto.
Thank you, Brother Linda, and good evening to everyone who's on the platform this evening. I want to also thank God for the organizers who have actually put this together. There is indeed a tremendous need for us to be appraised with what's happening around us in our institutions, in our home. And so I'm very, very excited this evening. I'd like to also thank God for all the presenters that have availed themselves to be a part of this seminar this evening. God bless you. Thank you for coming. I'm sure that your sharing with us will be invaluable and that so many persons will be blessed and educated by your participation. Every single person on this platform, we want to thank God for you and trust that when we leave here, we are going to be much richer than we came. Have a tremendous evening. Please be prepared to ask all the questions that you might have and those that might develop during the presentation so that we leave here very, very informed. I thank you, Brother Linda.
Thank you. Thank you very much, Bishop, for bringing greetings. I just want to invite everyone as this presentation goes ahead, make sure you take notes, you have your notepads or your laptops, whatever, and you make notes of important things so that you'll be able to ask your questions and you'll be better prepared to deal with this subject wherever it may occur. Thank you very much. At this time, I'll be inviting Sister Crystal Ware to be introducing our moderator. Over to you, Sister Crystal.
Just allow a second that she's made co-host so that she may unmute herself.
Thank you, Brother Chris. Good evening, ladies and gentlemen, esteemed friends and well-wishers. Allow me to introduce to you this evening an individual who has dedicated her career life to the noble cause of education. She possesses a unique blend of passion, expertise, and an unwavering commitment, making a difference in the lives of students. Although still a young woman, she has touched the lives of countless students, families, and colleagues alike. She is married to the beloved musician Dacian Morris for over 10 years. Our moderator currently serves as a lecturer, sharing her expertise and insights with teachers in training. What truly sets our guest apart is her unwavering faith and commitment to serving others. She exemplifies the values of love, kindness, inclusivity, and the work she does. In the work she does, rather. Her faith not only guides her actions, but also serves as a source of strength and inspiration for those around her. Ladies and gentlemen, without further ado, please join me in extending a very warm welcome to none other than Sister Kimberlyn Morris as she comes to present in Jesus' name.
Good evening, everyone. Could you confirm that I'm being heard? Mr. Simpson?
You're being heard.
Thank you. Our presiding bishop of the MZAT group of churches and host pastor of the LPT, Mr. Frank Anthony Otto, Mr. and Mrs. Lindo, leaders of the Family Life Ministry, guest presenters all in your varied capacities, other bishops, pastors, ministers, parents, teachers, friends, and other members of the LPT ministry, good evening. I would like to advise you of the rationale behind convening this Autism Awareness Forum. This initiative stems from the recognition of the significant impact that autism spectrum disorders can have on the lives of individuals and their families. Autism is not merely a diagnosis. It is a lived experience that manifests itself in a variety of ways. We do not only want to raise awareness this evening, ladies and gentlemen, but to also foster a culture of acceptance, understanding, and empowerment within our communities. By coming together to learn, share, grow, we can ensure that every child, regardless of their neurodiversity, has the opportunity to reach their full potential and lead fulfilling lives. Before the first speaker is introduced, please allow me to pause and tell you about our co-moderator. Zoya Knight Samuels is a graduate of the Micah University College and a trained special educator who has served in the capacity for almost 5 years. Throughout her career as a special educator, Mrs. Samuels has demonstrated a steadfast commitment to advocating for the rights of individuals with disabilities. In her role as senior teacher with supervisory responsibility, she has managed to inspire junior educators to also strive for excellence in their practice. She's passionate about the field of special education and wholeheartedly believes that within every individual lies a hero or heroine. Once we have identified our inner strength, we can move forward and unleash the greatness that lies within. Ladies and gentlemen, please use your emojis to help me welcome Mrs. Zoya Knight Samuels, co-presenter for the evening. Mrs. Samuels, over to you.
Thank you, Mr. Morris. Am I being heard clearly?
You are being heard clearly.
Great. And I'm going to say good evening, family. I feel like a family on this platform, you know. Okay, thank you. It is truly an honor to be here this evening to share with you on this platform. And, you know, of course, it would be rather remiss of me not to commend Mrs. Morris for launching such initiative. Of course, you are aware that we shine light on individuals with autism for the month of April. And so, my sister, big commendation to you for using this platform to spread awareness. Additionally, I also would like to extend a quote of gratitude to Bishop Otto, Frank Otto, for the support lended in making this program, I'm going to say, what it will be. Yes, we're truly grateful for you, sir. You know, when I looked at the flyer, Mrs. Morris, I realized that it is in partnership with the Family Life Ministry. And, you know, while I was embarking on my little research, I found a quote, and it says, autism doesn't come with an instruction guide. It sometimes comes with family who will never give up. And I'm happy that the unit, the family unit, is being represented here today. And it is with hope that whatever information that we will garner, we will be able to meet the needs of each member, more so those with autism. Now, of course, without any further ado, I will now introduce to you our first presenter. Soini Williamson is a special educator with over 15 years of experience working with students with intellectual disabilities. Ms. Williamson is a hardworking, dedicated, creative, and resourceful individual who believes in the benefits of teamwork. She firmly believes in the value of assessing every situation with the intention of making it better. She pays attention to detail and brings a smile and positive energy wherever she goes. Ms. Williamson is a senior member of staff at the Winter School of Special Education, where she oversees the autism program across all 5 units. She has ably been doing so for over 5 years. During this time, she has conducted several workshops and hosted numerous activities aimed at spreading awareness and acceptance about the condition. Ms. Williamson firmly believes that by educating the wider public, individuals with an autism spectrum disorder will have a greater opportunity to maximize their potential. Please help me make welcome to Ms. Williamson.
Good afternoon, everybody, and thank you very much for having me. Thank you, Mrs. Samuels, for your welcome. Are you hearing me? Does anybody?
Oh, yes, we are. Yes.
Okay. All right. Before I go into this presentation, I would just like to extend an extra thanks to Mrs. Morris for your initiative and also for inviting me to be our speaker here. All right. Moving straight into our presentation. Now, what is autism? Now, autism, otherwise called autism spectrum disorder, is a developmental condition caused by differences in the brain. Now, people with ASD have problems with social communication, interaction, and we may also see restricted or repetitive behaviors. Now, according to the CDC, autism is observed in 1 of every 36 live births in the US. Now, here in Jamaica, we have also noted that the prevalence is, well, the frequency can be matched to the reports given from the US. Also, research has shown that boys are almost 4 times more likely than girls to be diagnosed with an autism spectrum disorder. Now, there are many myths. We have persons saying that it may be the vaccine. Sometimes they may say it may be the age of the parents. But according to research, there is currently no known cause for autism. And as a result, there is no known cure. However, what we can do is use therapy. So based on the limitations of these individuals, we can offer services to address their individual needs. Now, characteristics of individuals with autism. And I also want to point out that these characteristics are often observed before the individual is 3 years old. Now, some of these characteristics include they may avoid making eye contact. You may see repetitive movements. You may see the hand flapping, the rocking back and forth, the hand flicking. You may also notice that these individuals tend to repeat specific words and phrases. They are also prone to having what we consider meltdowns. Oftentimes, people misinterpret meltdowns to be tantrums, but we will discuss that further on in the presentation. Now, other limitations that may be observed include limitations in communication and social skills. Individuals on the spectrum, they do not generally pick up on gestures, right? They may not recognize other social cues. Communication, while some may have words, it may be difficult for them to engage in a full-blown conversation with you. They have difficulties understanding emotions and facial expressions. You may see fixation on certain objects, and you may observe, especially in the younger persons, you may observe them frequently lining up objects. Also, please note that not every individual with autism will display all the above characteristics. Now, if it is that you have observed some of these characteristics, what are you going to do? Well, all of us are not privy to diagnose. So there are some places that we can refer, and the experts will conduct these assessments. Some of these places, you have the Learning Center, you have the Macam Child Development and Resource Center. You also have the Michael Care Center. For our younger children, what we can do is, once we notice the delays or we see these signs, we speak to the pediatrician, share our concerns, and the referral process will take place from there. Now, earlier I mentioned a meltdown. For us to note, many people with autism experience a meltdown. That means they have a sensory overload. Now, this picture on the screen is depicting a child that may be having a meltdown. A meltdown often looks like a tantrum, but the difference between a tantrum and a meltdown, the tantrum can be controlled. For the individual with autism, when they're having a meltdown, they are not able to control what they're feeling. And the meltdown is as a result of a sensory overload. No, just a formal definition of meltdown. A meltdown is an intense response to an overwhelming situation. It is a complete loss of control. Individuals with autism often have difficulty expressing how they feel. So they may be anxious or overwhelmed, and this leads to the involuntary coping mechanism. And this is what we call a meltdown. All right, so just this nice little thing for you to read. I want you to read it to yourselves, internalize. I'm going to give you about 5 seconds to do that. All right, moving along. Now, just showing an individual with autism may not speak, they may not follow instructions, and may not act in an expected way. They may wander off or have no awareness of danger. Just for us to remember, autism does not have a cure. So if you have a child with autism, just remember that child is going to grow up to be an adult with autism. So many of the concerns that we have in our children with autism are the same concerns that we have in an adult with autism. So it is up to us, the community, the family, to offer support so that we can include these individuals. On the note of inclusion, as mentioned earlier, individuals with autism, they do not understand sarcasm. They are very literal. So when you are speaking to these individuals, you have to be very literal, clear, and concise. So, you know, Jamaican talk, why the food wicked? While communicating with somebody on the spectrum, we do not use those terms because they may just well believe that this food is wicked, right? In communicating, when something is good, we often say, why that body? We have to be very literal with communicating with individuals who are on the spectrum. You also want to address him or her as you would address any other person. Do not speak as if the person is not in the room. And we are going to appreciate variation in communication. Now, autism is a spectrum disorder. It has individuals falling from different ends of the spectrum. You may have some who are verbal, some who are echolalic, some who have no words. You may have some communicating by pictures, and this is what we speak of when we mention the variation in communication. So if the individual is nonverbal and they have something to communicate and they use a picture, we are not going to think of them as any less. We're going to communicate with them because that is the way they know how to communicate. If you are going to change something in the schedule, you're going to change a routine, you want to ensure that you inform individuals with autism about this change prior to this change occurring. Individuals with autism, they often work on a particular routine. Once we change this routine, we may see meltdowns happening. We are also going to respect their space and sensory differences. Individuals with autism have, as I would call it, an overactive sense. So when we hear something, this individual with autism may hear it tenfold. What we see, they may see this tenfold, right? So we do not want to be putting too much on these individuals at one time. And most importantly, while communicating and interacting with an individual with autism, we are going to be kind. Kindness is universal. We're also going to be aware of anxiety. So just like the typical person, when we are anxious, we have several signs. Individuals with autism, their signs may be more pronounced. So you may see increased rocking, you may see the increased spinning or the hand flapping. And once you see this, we are going to remove the individual from the situation that is causing this anxiety so it doesn't result in a meltdown. Now, here we have some support centers, whether it is for the individual on the spectrum or for their family who needs some support. We have the Jamaica Autism Support Association, and that is JASA, and we also have the Montego Bay Autism Center. These centers, they provide, motivation, and they have meetings, they provide guidance for individuals who are on the spectrum and also for their families. We just want to take a look at some people who have been diagnosed with autism, because a lot of people believe that once you get a diagnosis of autism, the world done, that is it, you will not amount to anything. No. We have Albert Einstein, we have Elon Musk, we have Isaac Newton, Michelangelo, and there are so many others. In fact, there are quite some, well, there are a few movies. I will share them with Mrs. Morris at the end of this presentation. So in your spare time, you can go and you can view these movies to see how we can include people living with autism, right? And here we have Miss Israel Harrison. We're going to be hearing from her later today, but she is a famous Jamaican who has been diagnosed with autism. So just to remind you that a diagnosis is not the end of the world. It's not the end of the world. And it is just up to us, the community, to support these individuals and for us to guide those who are not aware of the condition and to remind them that early intervention is key. What we are looking for in Jamaica, we're going to start right here on this little platform, is change. We want to ensure that the whole Jamaica is more accommodating of persons living with autism. And just a little reminder as I close my presentation, different does not mean less. And that takes me to the end of my presentation. I do hope that it was meaningful. And at this time, if you have any questions, please feel free to share same.
Thank you very much, Ms. Williamson.
You are most welcome.
Online, here on Zoom, on YouTube, on Facebook, you may type your questions in the chat. Those on Zoom, please use the raise hand symbol. And as soon as we see you, we will allow you the privilege of unmuting so that you may ask your question. Okay, we see Sister Valerie Brown. Please wait to be made co-host so that you may go ahead with your question.
Okay, thank you very much. Good afternoon, everyone.
Good
Miss
afternoon.
Williamson, you spoke about sensory overload, and that, jumped out at me. So I'm thinking, and I'd like you to advise me, if I have a child in my classroom who is on the spectrum, does that mean that I might have to remove that child from the setting, sometimes give him or her a break? Say I have a 1 hour session. Does it mean that this child might need a break after 30 minutes? So that he will not have a meltdown or a possibility for a meltdown?
All right. Thank you very much for that question. And I am very happy that you shared. No, I just want to point out to everybody that students with autism, they have different characteristics. So what you would need to do, Miss, is to observe your student first and foremost. You may not necessarily have to remove every child with autism to give them different breaks. So if that particular child is having a meltdown or you see the signs of a meltdown, yes, you can do that. But it is not something set in stone that they have to be removed every 30 minutes or every 15 minutes. It varies per child, right? And it also depends on the activities that you are doing. Say, for example, you are having a music lesson and this particular student is having a overload based on the sound. You may need to remove that student based on the subject that you are doing, while that same child may be able to sit out an entire math lesson because it is not as loud, right? Also, some things that we do, we may ask whether it is some schools may provide it or the parents can provide it. Sometimes they use the earphone If it is that they're having a overload because of the noise, sometimes you have to be careful of the lighting in the class. Sometimes if you have, say, bulbs flickering, you have to pay attention to those. So it's quite a few things, but observation, because every child is going to be different and their needs are going to vary. Did I answer your question, Miss?
Miss Brown, was your question answered? I'm not sure if she's able to respond.
Okay.
I see another hand. Faye Page. She's muted, but can you text to let us know if your question was answered? Miss Brown? Mrs. Brown? I hope it was answered. I'm not seeing your response just yet. But could we go ahead and unmute Mrs. Faye Page at this time?
Good afternoon. Am I unmuted?
Yes.
We are hearing you. Please go ahead.
Are you hearing me?
Yes, we're hearing you clearly.
Okay. I have been familiar in teaching these children from about 2006. And what I understood with them, each of them, as you spoke, have their individual needs. But the key thing I come to observe with each one of these children is communication. They love when you take time out to communicate with them. Even to you, if it seems like foolishness, they just want a little attention. And once you give attention to them, you'll be surprised to see how quickly they become settled in a classroom and adjust. They will now touch you and want you to give them things that they will never knew. You never knew that they would have wanted, want to participate by doing what they see the other children doing. So what I do, I use the normal children as a motivation to the children that have artistic, because I mix them. I do a mixed breed of teaching. So the other children now realize that they have a little challenge. So they too now become aware, and they too help them in their time of when they want to freeze. You have a time they just scream, and when they're having a screaming moment, we said, okay, class, just a moment, please. And you'll say, allow Faye a 5 minutes break. She's about to make some noise. And the children understand. And after that 5 minutes break, then we come back to what we're doing.
Okay.
I hope somebody can try that method. That's a good one. That works for me over the years.
Okay.
And I presently have 2 now. Yeah.
Okay. Thank you, Miss, for that. And I really appreciate that. I really love when I hear of inclusion, because I think the population here in Jamaica in general needs to understand more about autism, and the best place for it to start is in the classroom. So when you have a child who has been exposed to a peer with autism, when that child grows up and interacts with an adult with autism, it will not be anything new, and they will be able to manage well. They will be able to accept and to interact appropriately with individuals with autism and other disabilities.
Thank you for that question and response, ladies. We'll now take a question from Venice. And while she's doing that, just a quick point of information. After all, it is a learning forum. Autism is something that is very new to us. It's something we may not have known about until now. Earlier this afternoon, somebody asked, well, what about ADHD? Why are you only talking about autism? We have up to 13 categories of exceptionalities. And so we could not have exhausted all of them this evening. But just to point out, we will refer to students who have been diagnosed as having autism as a child with autism, we use person first language. So it's a child with Down syndrome, a person with autism, and so on. We acknowledge the person first. Secondly, normal is a blanket statement and it's a blanket label, I'd say, you know. What is normal for you is not necessarily normal for me. So then we'll refer to these individuals as those with a disability or an individual without a disability, rather than saying a normal child versus an abnormal child. You know, we have different advocacy groups who, because of their advocacy skills and shedding light, and persons who have children with disabilities, they have fought tirelessly to change some of the terms. So we don't even refer to them as a handicapped person or retarded, idiot, fool, and so on. All those labels have been put away and done with, or should be put away and done with. All right, is Venice able to go ahead with her question now? I see that question about schools in St. Catherine, and I'm going to address it in just a moment after Venice shares her question.
Good evening, everybody. Yeah, when I heard that normal statement too, my brows went up and I'm like, whoa. And we've come a long way, I must say, as it relates to how we speak about persons who we deem different. And so I'm happy that we're here this evening. One of the things though, I find out is that most of the time, the poor children not even feel different. But then here are the parents who makes them feel different and act weird, you know, not wanting to carry them out, not wanting to talk to them, to relate to anybody else. And how do you get inside that parent's head? That's my question. How do you get inside that parent's head? How do you get them to understand that, look, it's not that bad? And we are coming from far and we are going way beyond that which we had before. So how do we help them to understand that, look here, treat the children normal?
All right. Just want to say I am in fact proud of Jamaica. We do have a far way to go, but I do see where we have been making progress in informing not only our parents, but the wider society about individuals with autism and other disabilities. Now, how do we get the parents to be kind? I'm gonna say be kind, not only to themselves, but to the students. And that is where we come in, the schools come in. Well, I know for my school, we have a lot of parent training workshops, and I see coming out of a lot of other institutions, they have been doing this. So the professionals now are sharing this information with the parents and other members of the wider public. I think it is just for us to educate, because sometimes it is ignorance why we have individuals with disabilities being treated less than. So I do not understand what this is. I do not know how to treat with you. And what we often say to some parents who, because the child may have autism or another disability, is you do not want to, quote unquote, handicap that child, right? Because by you being overburdened, you may provide too much support. And by you providing too much support, you limit how much that child can accomplish.
Thank you. Just to point out that for this segment, we go up 7 o'clock, accommodating questions. So we have just about 5 more minutes, which also means we will not be able to address all. There was a question in the chat asking, are there schools in St. Catherine that cater to students with special needs? Would you like to take that one also, Ms. Williamson?
Okay. No, just throwing it out there. Yes, there are schools in St. Catherine that facilitates students with special needs. However, I would recommend that you get the assessment done, because once there is no diagnosis per se, you may find it challenging to get that child admitted to an institution, right? Also, the assessment would identify what the disability is, and the school that that child goes to will be dependent on the diagnosis. Now, for us to note, remember that autism is a spectrum. So you have some students who can be admitted to the typical school, as we call it. So we just have to get the diagnosis, and then we follow due process afterwards.
Thank you. And what I love is that there are several responses to that very question in the chat. But also you may visit the JADE organization online. That's JAID, Jamaica Association on Intellectual Disabilities. And you should be able to see some of those schools that are within the St. Catherine area. And I like the point that Ms. Williamson raised. Not everyone as diagnosed as having a disability will be placed in a special school. These individuals are placed in the least restrictive environment. And what do I mean by that? This is where they learn best. So if a child, based on his or hers, diagnosis and the nature of it, they may learn best in a special education school, whilst others, as she said, will be placed in the general education school. We'll take one more in this segment, and that is from Mr. Solomon. I know him to be a principal of the Lorna Auto Preparatory School. Go ahead, Mr. Solomon.
Good afternoon. Wonderful presentation. Just a question. I'm not sure if there's research to support this claim, but simply from observation, personal observation, it would appear as if there is an increase in their number of cases of special needs children. When I compare, back to earlier days, I'm not sure if you have noticed, but I'm wondering if my experience is giving me this, point of view. Do you believe that there's an increase in autistic case of autism and special needs, or based on the data, it has just been the thing over the years, but has not been publicized as much?
All right. I am really happy that you raised that question. Going back to the data, in 2023, they said that, giving you the data from the United States, 2023, it was reported that 1 in 36 will be diagnosed with autism. However, the years prior to that, I don't quite remember the year, but I know it was before 2023. They said it was 1 to 43. So it would have been 1 to every 43 live births. So what they're saying is that there has been an increase in how many are being diagnosed. So it is not necessarily a case that more people are being born with this condition. It is a matter of us now being more equipped with identifying these conditions and us having more technology and more awareness. So when we see these conditions, we can say, all right, this is the process for us to take to get a diagnosis. Also, as we take it back to our Jamaican education system, I think more people are now aware of special education. They are more aware of disabilities. And as such, we no longer have as much people say hiding these children when they're born. They're no longer being hidden at home. They're no longer being locked away. Persons are stepping out and saying, all right, you have a disability, you still get an education, and we're taking you out of the home. So I think it's a mixture of both. Technology has increased, so we are better able to identify these, and the persons are more aware. So they're no longer being hidden.
I saw somebody posted in the chat about that there might also be an increase. So you said that it's pretty much based on diagnosis and not just the fact that there might be an increase in general.
Correct.
Okay, thank you very much for your question, Mr. Solomon. I hope it was answered to your suiting. And I'd like to also thank you, Ms. Williamson, for answering all those questions. We are going to pause here and just make you aware that there will be other opportunities for questions to be asked. And I like the fact that you said you're using the data. So we can make speculations, but remember, we have to speak based on data. So perhaps that is a research that one of us here could take on to find out if that is so. We are going to be moving right along to our second speaker who has been here, and she was very early. And just to reiterate, you will have an opportunity to ask other questions. Ms. Williamson isn't leaving, and so those other questions that were not addressed yet could be addressed at a later time in our evening's proceedings. So I'd like to pause at this time to introduce our second presenter. She's Dr. Shauna Miller, a school psychologist who works with both children and teens. She received her doctorate in school psychology from the University of Florida, specializing in early childhood and early intervention. She went on to complete her postdoctoral experience in medical psychology at the University of Florida. She has supervised and taught teachers and clinicians, conducted assessments and therapy for preschoolers to adults. She conducts assessments for children as young as 2 years old for a wide range of concerns, including learning problems and autism. This evening, she will share with us information about the Microcare Center, as well as she's gracious enough to answer a few questions that you may ask at the end of her presentation. And I'm just going to insert a question that I hope she'll address at the end. What is the job of a school psychologist? What is the job of a school psychologist? All right, without further ado, let us make welcome our second presenter, Dr. Miller.
Thank you for the introduction. Thank you for having me tonight. Everyone can hear me. I can be heard.
Not clearly at this time, not hearing you clearly.
I'm not sure what the issue is.
Let me just pause to thank our technician, Mr. Simpson, Christopher Simpson, who is working and monitoring for us. Could you say something again, Dr. Miller? Let us check.
Say something.
Brother Chris, how was that on your end?
I'm hearing, but it may be the challenge could be with our internet that is preventing the sound from coming through properly.
Right, that's what I'm wondering, if it is maybe the internet that is, you know how internet is around here.
We're hearing you now. You can go ahead.
Okay, all right. Hopefully I can get through clearly. So for tonight, thank you again for having me here. As Ms. Mars said, I will be talking primarily about what we do at the Microcare Center, which is where I work, as part of the assessment team. I'm going to talk broadly about assessment in general. I know lots of people might hear the term assessment and not be entirely sure what it means. School psychologist is actually just a general psychologist that might have extra studies in education and assessment. So in the States, which is where I train, and the states where I train, they have school psychologists in the school.
I am terribly sorry, Dr. Miller, to interrupt your presentation, but we really are not hearing you. I don't know if it's possible for you to change your device so that you may speak closer in the microphone. I'm not sure.
Maybe I'll try changing location.
That's better. Maybe you need to come closer.
Yeah.
Okay. So while she does that.
Sorry, how is that? Is it better in terms of hearing? No?
Someone is suggesting that you turn off your video to reduce the bandwidth. That may help.
The video is off. Are you hearing me now?
Still faintly.
No, oh no. All right, hang on. Let me try. Keep trying and I'll try something else.
I don't know if an earphone would help, perhaps.
I'm going to try my phone to see if the phone is better for some reason. Did you hear that?
I know you said something, but I didn't hear. Okay, she's still trying to make an adjustment. Let's please bear with her. We know how technology works sometimes. You really can't predict what they will do. And so we're trying to make some improvement. Someone is suggesting that you could also leave the meeting. She's going to try her phone to see if that works better. So let's just give her a moment, please. Thank you. Mrs. Samuels, do you have a did you know question for us? Not question, but information.
A feature?
Yes.
Well, I actually feel generous and I want to give away something. So I have a question for someone.
Okay, please go ahead.
All right. So, true or false? There is a known cause for autism. Of course, you can open your microphone. All right, I'm seeing Samantha with quick fingers.
Okay.
Samantha with the quick fingers. All right. So we have something for you, Samantha.
That one was too easy, Mrs. Samuels.
You're saying it is too easy?
To the first person who responded.
I didn't hear
it.
Repeat.
I didn't hear that. Solomon.
The cause is the sin of man, oh Lord Jesus.
Myth alert. Myth alert. In the chat, it would seem as though it is Samantha Taylor who answered first.
Yes,
it is. Samuels? Okay, so here's what we're going to ask you to do, Ms. Taylor. Just type your phone number as well as your network so that we could give you some credits. Is that okay with you?
A direct message, Mrs. Morris, in the chat.
Yes, I'm seeing it. Samantha?
Okay, great.
All right, while Samantha tries to make a decision. All right, Dr. Miller is back and she's asking to be added as co-host. She has changed her device.
What device is she using on? She asked
Shauna Miller, Dr. Miller?
I'm not seeing her with that name.
He's not seeing you with that name. Could you rename your device, please? You could probably label it as 2 as well so that we're not confused.
I think I have her.
Okay, thank you.
I think.
Oh, there we go. Congratulations to you, Miss Taylor. Dr. Miller, you've been made co-host.
Okay, good afternoon. How are you guys in terms of hearing me now?
Yes.
Clear.
Okay, great. I'm trying to think where I was. Okay. Let me start from the top. I said, thank you for inviting me. I said that I was going to talk about assessment in general, then talk about autism assessment, and then talk about microcare. I had wanted to explain what a school psychologist is. A school psychologist is really just a child psychologist that might have extra training in school settings and assessments, right? So I was trained in the States. Typically in the States, they have a school psychologist assigned to every school, and they typically help with identifying children who have issues completing the assessment process. Then they might also do different things in the school, like conduct therapy, etc. So that's kind of broadly what a school psychologist is, like a child psychologist kind of in the school setting. Okay. I had also wanted to just add to what Miss Williamson said in terms of, I know there was a question around the increase of children with autism and other conditions. And I really want to just, again, emphasize that there really is, I think, an increase in the identification of children with these conditions. I have noticed, certainly in my work, that of course there's a strong genetic component with autism, with ADHD, with learning disabilities, actually with most of the conditions. And most of the times when I identify a child with autism, there might be a parent or a grandparent that also have that condition. It just was never identified. So it's fairly common for those conditions to run in families. And what we have now, I would say, is there's an increasing awareness of what these conditions are. And so there's greater identification that occurs. But it's less so that these didn't occur in the past, it's just they weren't identified, if that makes sense. Okay. All right. So I want to talk about assessment in general. So assessment is really the process of how we make a diagnosis if there's something happening for a child, right? So you want to think of an assessment when a teacher or a parent says they want to have an assessment done, it's usually because there's a question that they want answered. There's something that they've been observing, they're not really sure what's happening, and so they need a sort of a formal investigation of what's happening so that they can answer the question. Why is this occurring? What are these behaviors or these problems that I'm seeing? Is this our problem? Is this our actual problem? And is there a diagnosis? So it's really, assessment is the process of trying to figure out the answer to questions, really. An assessment broadly involves a number of different steps. Most people think of it as just doing a test, but an assessment really covers a number of different things. So it includes the information you get from parents through interviews. It includes the information you get from teachers about what is happening. It includes actual standardized tests. So you might ask the child to come in and you do very structured tasks to compare how they react in those conditions compared to how other children react, so that you can, get a sense, are their behaviors, is their functioning, is their knowledge, is their understanding typical, or is it atypical? So you might include some tests, it includes observations. So there are a number of different things that are part of the assessment process. And as I said, the goal of an assessment is to answer a question, right? So there's a question that the teacher has, there's a question that the school or the parent has, and the assessment is supposed to come up with an answer to that question. So for an autism assessment, generally the question that needs to be answered usually is this child on the spectrum? Or it might come about that we've noticed all of these behaviors that are occurring, and as part of when you're doing the assessment, when it comes to you as an assessment, you say, well, I wonder if this child is on the autism spectrum. And so there's more specific steps that you would include as part of the assessment to answer those questions, okay? So like I said, an assessment is a whole process that includes a lot of information. Or if you're trying to answer the question as whether this child is on the autism spectrum, again, it's similar. You would get information from the parents, especially about early development, how this child interacts with others, what is their communication style, what kind of behaviors are they seeing? So you just get information from the parents. Similarly, you might get information from the teacher as well. Some of that information you might get through rating scales. If anybody has been through the process, you might get a form that the assessor will ask you to fill out, and it will have a number of different questions that will ask different behaviors of parents and of teachers to say, are you seeing these things in this child? And so that's part of the information that you collect to see, well, to tell you whether you're seeing behaviors that kind of fall, that is typical of the children when, on the autism spectrum. So you get rating scales. Then you also do include other things that you'd include in any assessment. You kind of get a sense of their reasoning ability. You get a sense of where they are with their academic skills. You get a sense of where they are with their independent living skills, like are they able to kind of function and do day-to-day tasks in a typical way? So there are a number of different things that you might kind of ask as part of the assessment process to make a determination of whether the child is on the spectrum. And ultimately, you look at all of that information to see, does it line up with what is the criteria listed in the DSM-5? So that's really where we make our decision based on. Same for any other condition with like ADHD or a learning disability. You're getting all of this information, and at the end you kind of have to say, does this line up with what is listed in this DSM to say that this child has this particular condition? And as Ms. Williamson mentioned, in terms of what the criteria is for a child with autism, it's really two main areas of deficits, right? Or differences, I should say. So there's usually a social communication difference. So they interact and socialize and communicate in a very different way, typically. And then there's also a pattern of either being very rigid or inflexible or having a lot of repetition in behaviors, right? So for young children, like Ms. Williams said, they might line up toys. You might see a lot of repetition of words. You might see a lot of sensory sensitivities, being very sensitive to sensory information. But it might look like being very into particular topics over and over again. This is what they want to talk about. It might be that they have problems, as Ms. Williamson said, with understanding more subtle forms of communication. It might be more severe that they just hardly ever communicate at all. So the reason why they call it a spectrum is that because there's a spectrum of behaviors that you might see. So it might be, you might see more severe kinds of differences or more milder kind of differences. But at the end of the day, the core features that have to be present to determine that a child, an individual or an adult has autism is that they have social communication differences. And then there are differences in terms of that they tend to be much more rigid, inflexible, and have a lot of repetition around some behaviors. So at the end of the day, when you're looking at the assessment, that's really what you want to kind of find out. Do I have enough information to say that these core deficits exist? And so I can determine that this individual is on the spectrum. At the MicroCare Center, right, which is one of the places that does assessments, we do it as a team approach. So I work as a psychologist, so I will look at, for example, their reasoning ability. So I'll do particular tests that look at that. You have a special educator that will look at academic skills. You have the social worker that will talk to the parents about how they function in day-to-day life, and as well as get some background information. You also have a nurse that will look at early development, and kind of, so we take a team approach to kind of looking at the assessment. I kind of get all of that information. We meet as a team, and then we kind of determine, what the diagnosis is, whether it's autism or any of the other conditions that occur for children. Is there anything else that I wanted to say about MicroCare? Yeah, that's primarily that's the approach that we take. I want to say also for autism assessment, so like I said, you get all of that information. There are particular tests that are specific to children with autism that we use at the center as well. Some of it is the rating scales that I mentioned. We also have structured observation using the ADOS, which is a specific test for autism, a very well-established test, where we'd have the child come in and we do certain activities with the child to see how they respond to different prompts, I should say, different prompts. And so based on how they might respond to those prompts will help you make a decision as whether they are reacting as a child with autism or they're reacting as a more neurotypical child.
yeah, okay. So that's broadly what I wanted to cover, hopefully, in terms of what an assessment is, what an autism assessment looks like, and then what we do at the microcare. I'll kind of leave it open for questions. I know there's been a kind of back and forth in terms of us getting this presentation started. So I'll kind of open it to questions. Hopefully all of that was somewhat clear, but I'll answer any questions that you guys have in terms of what I've said so far.
Okay, Dr. Miller, I'm going to be checking the chat for those, and I know that if it overlaps with the other presenters' delivery, you are well able to answer them as well. Okay, I'm only seeing 2 in Zoom. Okay. Someone is asking if you're confirming that genetics is a cause of autism.
I don't know if it's well, there's a strong genetic component. So conditions, all conditions tend to run in families. So typically, I mean, if you have ADHD in the family, then there's a higher chance of ADHD. If there's autism in the family, there's a higher chance of autism. I don't know if I would say it's a cause, but there's a strong genetic component.
Absolutely. And the research continues. The research continues, but it is one of those, things that is suspected to be a cause, along with environmental factors as well. Another question, Dr. Miller, is there a long waiting list at the microcare center?
Oh, there's definitely a long waiting list at the microcare center. Unfortunately, I mean, we are government funded. We cater to all of Jamaica, and we have very few clinicians. So there's always a long waiting list. It varies in terms of the time. I can't really say specifically what the waiting time is. Sometimes it's a few months, sometimes it's many months. I don't know what it is currently, but there's always a waiting list because there are many children who need an assessment, and unfortunately not enough clinicians to accomplish that task.
Mrs. Samuels, are you seeing any other questions?
I am scrolling. I am also on the YouTube platform. Not seeing any at this time.
Okay, I am seeing a few here. Someone asks, what if there is no one in the family with the disorder? Is it possible for someone else to, several generations later, receive such a diagnosis? I think is what Shanna wants to ask.
Okay, yeah, no, I mean, yes, absolutely. Yeah, that's not, it's not always the case that there is absolutely somebody with the disorder, and sometimes it's just having certain features of the disorder that you might see. But no, you can definitely have someone being diagnosed that neither the parents or the grandparents have that condition.
Thank you. Is it a case where sometimes these assessment results expire? Is there an expiry date? 3T, 10, 4G, I think that's the vein in which this question is being asked. Does a child have to be assessed more than once?
That's a current debate. There is, I will say, usually if you're diagnosed with a condition that is typically a lifelong condition, right? So if you're diagnosed with an intellectual disability, with ADHD, with a learning disability, et cetera, you will have that. It might change in terms of, intervention makes a difference. It might change in how, as you get older, but you certainly have the all the associated symptoms and behaviors with that. Now, the assessment report, they might need updated information, particularly for certain things. So, for example, if you need accommodations for a test, they kind of usually want an updated assessment to see exactly where you are, especially around academics, but along with everything. So it's not so much that the diagnosis is invalid or that the condition has changed. It's in accessing certain services, and there's certain schools that might want updated information, and so they'll want a more updated assessment. Currently, it seems to be that places will ask for it after every 2 or 3 years. No, there's no legal requirement as far as I know to support that, but that is what some places want.
Thank you so much for that response. I hope that answers your question. Is it possible for some children with autism to be extremely brilliant? I don't know if this person is segueing into giftedness. Perhaps
I mean, sure. None of these, so far, none of these actually conditions in terms of autism, ADHD, learning disabilities, those have nothing to do with your cognitive functioning, right? So your reasoning ability isn't affected by those conditions. Those are all, especially for autism, if you want to focus that, or ADHD, those are behavioral differences. So you can have you definitely have very, very, very brilliant people with autism, or again, children with intellectual disabilities with autism. So it varies just as much as with other neurotypical children. You can have very smart children or children with an intellectual disability with a condition.
Thank you. Someone is asking if there could be a change or a move on the spectrum. For example, can they move from a level 3 to a level 2? Cognitively speaking, I suspect.
Cognitively. Well, okay. So the levels that they have is really about how much the symptoms is affecting everyday functioning. It's not really about cognitive functioning. It's about how much those deficits that we talked about. So how much is those differences in communication and the rigid behaviors, how much is it affecting their everyday life? So like I said, they have some children who are practically nonverbal or nonverbal, right? So their communication deficits is severe, and it definitely is affecting their functioning because they're not talking. So that would be a level 3. Now, if it is that child then learns to communicate, starts to talk more, then they would be that the level of functioning is less affected, and so they move up a level. So the levels isn't really around cognitive functioning, it's around how much of the symptoms that you're observing is affecting everyday life. So is it that this child is so rigid and inflexible that they have a hard time with any changes at all? Then that's kind of a very severe kind of case of severe. It would be considered level 3. But if they sort of they can more or less function in a typical classroom, but they have some problems when transitions, right? So they still have the inflexibility, but it's not affecting them as much, and that would be considered level 1. So it's really around how much it affects their functioning.
Thank you. I hope that answered your question, Samantha. Please let us know. Okay, so Jefta is asking, are there any cases where a child no longer has autism? And I'll quickly go ahead and say no. Ms. Williamson has said earlier on that if you are a child with autism, you're also an adult with autism. So no, treatment does not get rid of autism. Another question for you, Dr. Miller? No, there are comments. I'm checking to see. Okay, are there any connections between savant syndrome and autism?
I don't know what savant syndrome is. I know there's some cases where an individual with autism are considered savants because they have highly specialized knowledge, genius knowledge, abnormal knowledge in a particular area, and so they're considered savants. And that's often because people with autism are usually very obsessive in a particular interest or field. So, and there might be things that they're extremely gifted at. So there is some overlap between this idea of savants and autism.
Very well, thank you. All right, seeing a few comments. But I'm jumping to the questions in the interest of time. So the comments are for all of us to see, and you may respond in the chat to it if you so desire. When they say a child has mild autism, what does this mean? That's so,
sure. As I previously, like I had said, in terms of the levels, because they used to talk about mild, moderate, and severe. Now they have it by levels, and so they're talking about how much the symptoms are affecting their everyday functioning. So when they say mild, it's really the idea of a level 1 child, meaning they don't require significant amounts of support. They can sort of go around. They can interact typically without a lot of their symptoms affecting their everyday life, basically. So they can, again, in a typical classroom, they might They might have friends. They might have problems in terms of their understanding of some communication. So that's what a level 1 is, or what they would consider mild. It's just requiring not as much support as maybe a level 2 or moderate, quote unquote moderate person that might need more support because they have a harder time with communication. They have a harder time with, what is typical in the classroom. They need a little bit more support. So that would be considered moderate. And then for more level 3, they're requiring a lot more support. So they need a lot more help with communication, a lot more help with transitions, a lot more help with various tasks. So that's mild, it just means they don't require as much support.
Thank you so much. Mrs. Samuel, I'm not sure if you're seeing any questions on YouTube just now.
The chat is clear, miss. Not seeing any.
Not seeing any. Okay, are there any raised hands? Does anyone want to ask a question, or they were all addressed in the chat? There is a hand, Brittany. So Brittany, please wait to be made co-host so that you may go ahead with your question.
Brittany, you can unmute your mic and go ahead.
Good evening, everyone. Are you hearing me?
Yes, clearly. We're hearing you.
If you have a child, he is nonverbal, but he is doing everything okay. Example, he will put together a 48-piece puzzle. If he needs something, he knows what he wants and he goes and he gets it. He's 5 years of age. He's doing his addition in the grouping section. He will spell words by writing. You show him a picture and he will go to the board and he will write the word. What level would you say that child is at?
Well, it's hard to say based off just of that example, but I mean, in general, even though he is sort of getting along and doing, getting along with a lot of other tasks, his communication is still not where it should. It's not typical. And so he does need help, more help than typical for communication, right? So even though he can sort of independently do things, he's unable to communicate his needs. He's unable to engage in typical communication, right? So I would still consider that a level 2 because he needs more support than typical for communication. So his communication deficits is definitely affecting, requires more support than typical.
Thank you. There's another question here from Mr. Solomon. You are already able to unmute.
Good afternoon, good evening, doctor. Apart from microcare, you mentioned that there's a long waiting time. Can you outline other companies, entities, places in Jamaica where where the assessment can be done, probably from a privately, because with that level of backlog, you might, well, personally, I'm aware from our school point of view that sometimes it takes over a year for a child to be assessed at microcare. And so, do you know any other private places that it can be done, or to expedite the time?
Sure, there are actually a number of places. I hope I don't get into trouble by I might forget places. And if other people know, please put it in the chat for sure. Certainly, I'm not sure if McCam Coroner does assessments. At UE Child and Family, they do assessments there with Dr. Samswan or with the other Dr. Garbut, right? Those are developing pediatricians, and so they do assessments for autism. There is Dr. Kai Morgan. There's contemporary assessments. I forget what the full acronym is. There is Caribbean Taxi Teams. There is West, I believe, although I'm not sure if they start very young. I'm trying to think of other places. There are a few places that do assessments. You might have to Google it and see what comes up, but there are definitely a couple of private. I mean, of course, with private, there's certainly a cost, right? The benefits of MICO is that it's significantly less. But there are private places that do. There are a few private places that do assessments.
All right. I was trying to make the notes, but I'll reach out to Lady Morris and she get it from me, all right? Because I would need all of those lists, all right?
Sure.
Thank you so much.
Absolutely. Okay. Okay, I'm not seeing any more hands raised. However, a few more questions are in the chat, and we have about 4 more minutes for this segment. Persons are sharing quite a few options in terms of getting your assessments done for someone you suspect may have a disability or autism. Okay, Mr. Don Lewis says that FDA has approved antipsychotic drugs such as risperidone. I hope I pronounced that right. Brother Don, could you please unmute and voice your question? While you get ready to do that, I'm going to move to Grace White. Is there a registry of persons with autism and are social workers assigned?
As far as I know, there is definitely no registry of children with any kind of disabilities. There's no registry of children with disabilities. As far as I know, no. And social workers are not assigned. We don't have a special education infrastructure here that might exist in other countries that would support that kind of a thing. So it really is dependent on the schools that the children are a part of to support the child.
Okay, she has a follow-up question to that. Do these persons require medication? And is it supported by MOHW? Ministry of Health.
I'm sorry, what? Oh, okay.
Is it supported by the Ministry of Health?
So no, there's no medication currently, and this might also touch on the question that you had mentioned about risperidone that needs to be vocalized, but there is no medication currently, certainly for the symptoms of autism. Risperidone and antipsychotics really are prescribed for more aggressive, significantly aggressive behaviors. And that's really, so there might be medication that addresses particular symptoms, and that's certainly not typical for most children with autism, but there are some children with autism or ADHD or any other behavioral condition that might have significantly aggressive behaviors that are harmful for themselves or harmful for others, and those children might be prescribed something like risperidone, but it's really to address those specific kind of aggressive behaviors. And I can't say as to whether that's supported by the ministry or not. I have no idea if that is or not. That's, that would be administered by a psychiatrist, and they would make that determination. But I would say that's a small percentage of children with autism that would need that kind of a medication. And there are no other medications that are helpful for the treatment of autism. As Ms. Williamson said, it's really primarily behavioral support that helps with the symptoms. Specific therapies to address communication, speech therapy, occupational therapy, those kinds of therapies are the things that are kind of more helpful.
Thank you. Okay, we have time. Am I still being heard?
Yes.
Oh, thank you. Thank you. We have time for one more question. Mr. Lewis, are you able to voice your concern? Can you indicate by raising your hand if you are able to vocalize your question? Okay, please wait to be unmuted or be made co-host. And that's the final question we'll take for this segment. If you raise your hand, I think it will be easier for us to spot you. Are you seeing him, Brother Simpson?
Go again, I did not hear that.
I was suggesting that Mr. Lewis raise his hand so that you will see him more easily. Would that help?
I had already identified him to unmute himself, so you can go ahead and unmute.
Thank you. Please unmute, Mr. Lewis.
Hello, are you hearing me?
We are.
Great. I was saying the question is already answered because she said that we do not do drug treatment in Jamaica per se. We do behavioral treatment. So I'd put it in the chat that the question was answered.
Wonderful. Thank you so much. And thank you very much, Dr. Miller. I'm sure you're not going to leave us just yet, but we're going to allow you to sip some water, rest your voice. And I now invite to the floor my co-host, Mrs. Samuels.
Thank you, Mrs. Morris. And thank you for the presentation so far, ladies. They have been truly informative. I now move on to introducing our third speaker, Jamaica's Israel Harrison, who has been dubbed the island's first autistic beauty queen. She finished in the top 8 at the 60th edition of the Miss International pageant held at Tokyo Dome City Hall in Japan. Israel is Jamaica's finest at pageant, following top 15 placement by Denise Thompson in 1987 and Michelle Williams in 1988. This special beauty is also an advocate for persons with autism and other disabilities. She is very passionate about the cause. Resultantly, she is guided by this quote: "Break the glass ceiling so the others can come through more easily." Ladies and gentlemen, Miss Harris.
What device is Miss Harris using? I'm unable to find her.
Okay, it's Israel Harrison. Not seeing that name?
No, I'm not.
Okay, let me just quickly check on it, please. In the meanwhile, do we have a giveaway, Mrs. Samuels, at this time?
Well, yes. All right, I have a did you know fact here.
Okay, I've located her.
Oh, you have?
Yeah.
All right, should I go
Well,
ahead?
go ahead, please, and then we'll move right along.
All right. All right. So, did you know that people with autism may need help to learn how to communicate and play with others? Did you know that fact? Yes or no? All right, I'm seeing some responses in the chat. Yes. All right, thank you.
Over to you, Israel. Please go right ahead.
Hello, everyone. I've been here for 2 hours, so kind of overstimulated, but still happy. My name is Israel Harrison, Miss International Jamaica 2022. I'm also a certified makeup artist, former musician, and performer. I am very passionate about autism advocacy and disability rights because it's my lived experience as well as it's experience of my niece, and hence why I'm here today. I started my advocacy because I am actually a late diagnosed autistic. Fun fact is I was diagnosed at age 25. I'm now 27 years old. So that was 3 years ago. Yeah, and yes, many persons didn't believe me because their thing is that they're saying, oh, you can't be autistic because you're so eloquent and you know how to socialize. But I know how to socialize because I was not separated from other kids, and I wasn't. Yes, I did go through bullying because the other children, they could definitely tell that I was different. I also knew that I was different, but I didn't know what it was. So I spent a lot of years struggling with mental health issues. Oh, thank you. And I think you guys mentioned earlier about what is a school psychologist. Well, I had two school psychologists because I struggled with depression. The depression coming with the low self-esteem of not knowing who you are. So you have to mimic other kids or whosoever is your best friend. That's who you would try to be like and act like, which is why sometimes we slip through the cracks because we're so intelligent enough to know that, hey, I don't want to get bullied, so let me par with this popular person or this bad girl, and that's who I'm going to pretend to be like. And as a result, you develop a lot of mental health problems. And yeah, so I wouldn't say that I am on the higher end of the spectrum because, yes, you have a question?
Israel, please, we're gonna allow you to take the questions at the end.
Okay. All right.
Address questions, Brittany and others at the end of Israel's presentation. Please continue.
Okay. I wouldn't say that I am on the higher end of the spectrum because to say that I am not, then persons would believe that, okay, she doesn't need help. However, I spent 3 hours ahead, no, actually it's 4 hours ahead of this meeting to make sure that nothing went wrong, that there's no meltdowns today because there is a meltdowns every day. And for the past hour and a half, I've been overstimulated because of the light. And overall stimulation is to be expected. So that's something that I accept. And this I'd say, adjust life and I'm just autistic. We don't say low or high functioning because to say that would be incorrect. It's a spectrum where you have OCD here, you might have ADHD, depression. There's so many other symptoms of autism. Everyone will fall. So there's a wheel, and I might be ADD, but maybe I'm not nonverbal, or maybe I'm not nonverbal, but I still struggled with communication and fitting in. But when I say struggle with communication, I mean I still take things literal, but I wouldn't take it too literal to the point when I was younger. Because the older you get, whether you're autistic or not, the more intelligent you get. If for example, like me, I practice life skill sets, because you can't afford not to. Because I don't know if you guys know, but 9 out of 10 autistic women are going to get sexually assaulted. And so learning life skills is literally life-saving. So this is necessary. So when persons ask me, oh, you can't be autistic because you're not like our 4-year-old. And I'm like, because I'm 27. And I've learned so many skills over the years that I need. My mom, so when I was younger, I need to tell you guys, when I was younger in basic school, as my mom mentioned about early diagnosis, I wasn't diagnosed early. However, I was not limited. So even though I wasn't diagnosed, I was not limited to say that, oh, she's autistic, so she can't do this. No, I was forced to socialize, to go out, dress up. My mom, church. Yes, I had to go to church as well. So when I call this radical exposure. So the more we get exposed to stuff, less likely we get limited. Society. Exactly. So we learn how to integrate from an earlier age, which is why it slipped through the crack. However, it didn't really slip, did it? Because I remember in basic school when my teacher, because I used to zone out in class, so my teacher called me there. She called me retarded, and she's like, "Oh, I'm going to beat you because this," and I didn't play with other kids. However, I was reading above my age level because my mom, she used to give me some big words as a kid, some really big words, and I had to know all of them, what they mean, the opposite, how to use them in a sentence. So yeah, don't limit your child because he or she is nonverbal. You can't say that, oh, they're on the lower functioning, and then you just put them in a box. You have to find their strengths and work on those strengths. So I worked on my strengths, and my mom, she didn't limit me. Exactly, encouraging words. So when I see parents and I see their kids reach a certain age, they're autistic and they haven't hit certain milestone, sometimes it really strange to me, and I can tell why that happens because they don't bring out their child. They don't bring them out to eat. They don't bring them out to walk, to park. They're not telling other family members. And so everyone is like, oh, what's wrong with your child? But they should know what your child is going through, hence to sensitize others. Yes, and to let them not be abused. So I mentioned that 9 out of 10 autistic women and boys will get sexual assaulted because they don't know how to identify what a predator is. So they don't know to identify what is dangerous because they don't know what danger is. How dangerous it is because we see world as we see the world in a naive eye. Even as we get older, even me now as I'm getting older, a lot of stuff I didn't know, things that I should have known about. For example, like sex or men and women or friendship. These are called life skills, knowledge. These are necessary for survival and success as well. And someone mentioned that their kid won't play with other kids. Yes, I didn't play with them either, so I got bullied a lot. They will find few persons that they will interact with who they can identify their self and then build self-esteem and self-confidence. Socializing.
Israel, I'm so sorry to break your concentration, but I do hear your mom in the background. I wondered if she wants to come next to you.
Yeah, I wanted her to come, but she can't because she's not
She's unable to, but we're really not hearing you, mom. We're hearing Israel only.
Yeah, I'm just in the background saying that integration is important to let them be in society, in the church, in the community, play with other kids. Sometimes it would disappear for a time and then it will come back because these children are not really crazy. They are just see the world in a different angle. However, they have strength, like if they like swimming, if they like musical arts. To me, these children are genius.
Yeah, as my mom always called it.
Because I recognize that she could observe more than the regular kids. There are 4 kids. And she's the only one I can take and teach certain stuff and she will hold it. So whenever I limit her, I just go ahead with her and expand with what I know she's good at. If it's music, I let her go with music. And if it's art, I let them go with art. Whatever the field. So you study the child, just study the child and see, oh, this child loves to run, this child loves to jump. Because sometimes they will be afraid of certain things. So when they see they're afraid of, they will move it. And they should not go to school where
persons that tell them say, oh, you're schizophrenic,
or you're
or you're bipolar. They should not be exposed to these people, especially when it comes to verbal abuse. They cannot.
They can't take it because then they develop low self-esteem, and some of us, remember, we're non-verbal, so we might not be able to express to a psychiatrist or to our moms that I'm sad or I'm depressed. No, we actually internalize all of this, and remember, we take things literal. So do you guys know what that means? When you take something really literal, we take it to heart.
Yes, they take it hard because sometimes we say that's a simple thing, but then again, it's simple for me and it's simple for you, but they take it on another level. So it all comes back to who they go out associate themselves with, because even in the church, to really educate these church people, because I have my granddaughter and I noticed it and I told them at my church, I said, they will say, oh, she is and she is that. We should normally speak the word over them because word is power. What we do is watch and pray and then say to these other persons, I'm here to integrate her, because that's what I do in my church. Because my granddaughter, I'm here to integrate her. So she go to Sunday school. She does not sit in the church with her. I do not hold her, and I allow other people to help me with her, so she understands that yes, she has to socialize. When I see the face contact now, shake hands, but while we are in church and we're in meeting, she will actually stretch my hands to somebody or help somebody. So integration is very important with them, and not to separate them and not to put them apart,
and not to stereotype them
or something like that that will break them and that will break them for life. For me, I do not take it from anybody. If she's at a school and these people are stereotyping her, I will
remove us. She literally removed us from the school, the home, school, community, from family, anyone who discriminates us.
I will remove people from out of her, because what I want them to develop a strong self-esteem. And while they're in the, you are the one who have to motivate them most of the time. And speak around them, let them know that look here, even though society says this and that, you don't have to do what society says. Break the stereotype and break the glass.
Break the glass.
And I will tell my children, so look here, the sky is the limit for you. The sky is vast and each one have their own way. Do not compete with nobody else but do
ourselves.
Your individual self. And I always believe that Israel that becomes a person where will motivate others. I always see when persons will say, when she have some down for I will just look and I will just say, God, but just no say. She and me have that becomes somebody great one day. And I told her, if any day you get to tell a story, you just tell your story. You do not worry about who you will, just be authentic and tell your story. Because these people go through challenges in life. And sometimes with the parents, we go treat with them because sometimes we can't understand why she diagnosed at a later point, because some part of her life in the primary level, it was not there. So when she touched the teenage, it is there.
It gets harder when you're in teen.
It will regress and it will progress. And yeah, I actually have to trigger what trigger these children to because they can see on the track.
Yeah.
Something will trigger them. And they need to not allow persons to really say, hey, you're different. They're not different. To me, they are the game changers in this world, the motivators in this world, the scientists in this world. This world, we are normal people. They are the ones that come to make a difference in this world. Not saying that they are different, but to me, they are the genius. They are the ones that see the world the way
they see the world through. We see the world through a different lens, which is why we like to change the way things is. the world is not built for autistic people, which is why we need a whole community. We need the government, churches, doctors, everyone needs to be on board, because it even takes a village to raise a regular child, let alone an autistic
It takes
child.
a village to raise a child, but depends on the village, because in the village you have persons who will abuse these children. It's a village to raise a child like these children, but what the government should do is not say let them have a special aid school, more than integrate, have a special aid teacher in every area of the school, in the primary school, in the basic school, which these children go with the other children and they go to their special teacher with. They will not be left out of any cultural thing, anything. So eventually they're not going to say, oh, what is it or what is that? But just involve them. When they are in church, involve them in music, involve them in art, give them something to do. Don't just leave them on the wayside, because if God did not want them here, they
wouldn't be here.
Here.
And the next thing I like to add is that we are very triggered by abandonment. So if we are abandoned, a lot of the times, especially for younger, we really shut down, and we can shut down for years. And there's a name for it. I think there's this thing called regression skills, where I lost, like literally, I forgot how to do makeup. I'm a trained professional artist. I forgot how to write poems. I forgot how to if I take too long to go outside and socialize, I literally forgot my skill. I forgot how to be charismatic, how to do small talks. So we have to like gradually develop our skills. Yes, and yes, true love is important. If you want to know if an autistic person will have good support, just look and see if the persons are loving. And if they're not, then that's not a space that your child can thrive.
No.
It's just, I've proven this over and over again, even as an adult right now. I've, 3 friends? And I chose these based on if they know about my condition, then they're not going to cause me to be burnt out all the time, where I can't. Because if I get too burnt out, I'm not going to go outside. I'm not going to be able to go to work. I'm just going to be depressed all the time. So how do I prevent burnout? Well, first of all, I stop masking. What is masking? Everyone does it. Well, how we do it, did I mention to you guys that, for example, if I have a bad friend and I know that everyone is afraid of that friend, in primary school or high school, I would latch on to that person and take on their persona, so to not go through certain things. So after a while, you don't know your personality, and it can lead to having personality disorder and mood disorder, which is why early diagnosis is, because you're going to have more problems if the child is not diagnosed properly. So why hide the diagnosis from the world?
Yes, definitely, because we the parents, we don't know how to handle. Some of the time we be very aggressive and it becomes overburdened, especially when you're a single parent and it's just like it just hits you like that and you're wondering, huh? Because to me, I knew that something was wrong, but we just
don't know what it is.
Some person that said bipolar,
yes, because I got misdiagnosed with major depressive disorder.
I do not believe that a child can be born bipolar or schizophrenic.
Schizophrenia.
I do not believe it, none at all. Because I have an experience with my granddaughter with this lady. She said, these people who said they are child givers or whoever they may be, and she kept the child for one day and she was discriminated. And I'm so glad that she did not understand the things that she was saying. I'm saying like, how can a child be born bipolar and schizophrenic? That does not make any sense.
Exactly.
It's not
These things are
children.
developed through
It's not every
later
children
life.
develop. It's about these children. They can identify a color and say that is blue. Without you even teaching them, you just have to study these children and get their weaknesses and work on their strength.
And
They can
and the next
count
point
accurate.
I'd like to add is that I notice you guys always mention levels and levels. Well, I think we all need to adopt the spectrum because remember it's a wheel and I might fall somewhere more up here because did you know that there is something called mild Tourette syndrome? Well, you have major Tourette syndrome. So one autistic person might have really horrible Tourette syndrome where they can't work, they can't go anywhere. While one, they might just only like have like you see them neck like this and them eye flash around. And for me as well, how so too much light, if I have too much red lights and blue lights, that can trigger me to have a seizure. That rarely happens though because I know my limits, I would say. So I don't go to parties and stuff. And I try my best not to go where I know I'm going to be burned to the point where I can't talk to people. Because when you get burnt out, see, you can't talk again. Did you guys know that? You can't talk. You can't talk. You forgot how to do everything. You literally shut down. You won't take care of yourself. You won't eat nothing. So this is literally a life or death situation. So hence why I have to correct individuals all the time because we are the ones who are going through this. So we have to advocate for ourselves. So that's why this is my mission. I always say this is my mission, this is my passion. Thank you. Oh, I was also Miss Photogenic for the person who said I was beautiful. Thank you.
Okay, Israel, I'm just going to interrupt you because I hear you saying you're experiencing some overstimulation at this time with the lights and so on, and you've been waiting for a while to come on the floor. But I'm just going to jump at you with one question or a request rather. I'd really like for you to share that special talent that you have as it relates to music. It's very, very interesting. Yes. And I'd love for them to hear. And then following you sharing that information, I'm going to be opening the floor for some questions for the ones online. I know Brittany would have been the first one to indicate that she has a question. Your mother, what is your mom's name?
My mom's name?
Yes.
Her name is Darian Harrison.
Yeah. Okay. Ms. Harrison, we just want to thank you for sharing with your daughter Israel and also to take this time to commend you for the awesome job that you did with her. You moved her when you saw the need because you wanted your daughter to shine. You homeschooled her at one point. You were her strongest advocate. I hear you say that you looked out for her strengths and whatever those were, you pushed her towards them. And today she is someone, a great force to be reckoned with. And also, so you're going to tell us about your rare talent, Israel. And you're also going to tell us about that other competition that you intend to vie for. So 2 things, and then I'm going to open the floor for a few questions so that you may get some rest.
Okay, guys. So I remember, person always asks me, did you go to university? Did you finish school? How can you speak so well? Well, I didn't finish high school, but I did try to pursue later education. However, as I left school, I joined a steel band, and when I went there, no musical experience, not trained at all, never touched a musical instrument in school, in high school or otherwise. Oh yeah, and I didn't want to do it. The same music opportunity came, and when I went to the band now, when my boss, whenever he said, okay, I'm going to teach you the cello, Israel, literally, him just start putting phrases, but my brain just, it's like me just know how to use the musical pattern without learning any theory, and I could just know the musical pattern. So within seconds, I could learn songs to the point where I can join every team and I'm traveling all over Jamaica. We're opening for artists like Sean Paul, Tommy Lee, and I am a part of the team that does the hardest shows and the most shows. And you know what they used to call me because they're saying that, oh, anybody we can learn the cello, them have to be mad because it's so difficult to learn those complex phrases. But even non-autistic persons, even they rarely found one that could learn the phrases and that fast. So my boss, he always loved to teach me, and that's how I advanced in the band because I wasn't good at making friends with other persons or let alone performing. So that was my strength. So when I mentioned to the Miss International organization, I told them that my program focuses on the strength. We don't focus on the weakness. So you will never hear me talk. You rarely will hear me talk about our weaknesses, even though we do need help. I like to play up on our strengths because I always say, talent, or when me have to use to take my life out of a certain situation. And as I left school, I have this job. And I was the one who left the job. And even up to now, they're still talking about me and how you have to be crazy to learn cello. But I found out that it's actually savant syndrome, and I'm not the only person with it. 2% of autistic will be savant. Not all, but even a regular citizen can be savant if they meet an accident or it can just come unsaid. But not every autistic will be savant. However, we have like savant like skills where we can learn. If on a sports, your kids are gonna be good enough, can be academic, but it has to be something, right? Because we're very good at systemizing. We like to put things together, solve puzzle piece. Anything with a pattern, an autistic person can learn it and master it even better than an average person, because that's how our brains work. When I was in the band, I learned bachata, salsa, merengue, because they had a 4 and an 8 step count where as a 2 seconds in, and I know to do the bachata and I know how to do this salsa, but persons are taking years to even learn it. And I'm like, whoa, I didn't know I was autistic. I just thought that was amazing. And so did my boss as well and everyone else. So as it for my next competition, Miss Universe, I am an official contestant of the Miss Universe Jamaica this year. So exciting, guys. So please support me. I'm very, very, very excited about this.
Thank you very
Thank
much.
you. And I'm so confident because I'm coming off of experience from the Miss International. So this is a continuum, guys. This is not something that I just come up with. I've been planning this for 3 years with my own organization. So guys, at a crown, me I go for at a crown. This patience is for the crown.
Thank you so much, Israel. Samuel, would you like to jump in at this point?
So exciting.
I'm hearing her so clearly, but
any questions?
While I give Brittany an opportunity to be unmuted and to ask her question. Brittany, raise your hand again, please. But I just want to also pause to acknowledge my viewers on YouTube. I see Coach's Desk TV. Thank you so much for being with us this evening. We really appreciate your presence, as do all the others. So we have Leota Vassal. I highlighted Coach's Desk because I know who he is and he's an LPT member. Please excuse me for being biased. We also have Mrs. Nicole Walker, Mark Newman. Okay, Mark has a question that I think I'm going to. Dr. Miller, are you still here with us? Hi, Nisi. This is Israel's niece, everyone. She's been diagnosed with autism, you said? Israel? I believe you're muted, and she's 4 years old. I read your lips. She's cute, Jody and Dill says.
Yeah, she's 4. She's autistic. I'm not her mom. This is my niece, actually. Say hi. See, she never used to do those stuff. She never used to even do eye contact. So with support, with the right support, I noticed that we hit our milestones.
Okay, thank you. Brittany, do you want to go ahead with that question? No? Okay, let me just quickly run to the chat to see if there are any questions. I see a lot of comments. You're beautiful. Big up yourself, mommy. Thumbs up to you, mommy. You go, girl, says Venice to you. Israel, you're amazing. And my husband is a musician, Israel. His ears perked up when you mentioned your skills as it relates to music. All right. Jodian had something to add as it relates to savant qualities. She says they are more common among persons with autism than in other neurotypes. Crown her, Mrs. Campbell says. Excellent delivery, Izzy. Okay. All the best, Israel. Proud of you and your mom, says Kenneth Barrett. Okay, Dr. Miller is still with us, but she's muted. Mr. Simpson, are you able to unmute Dr. Miller once more? Mark Newman is on YouTube.
Yeah, she's on. She can go ahead.
You may go ahead, but I'm gonna read the question. Why those kids with autism, why are they picky eaters? I think he's asking. He has issues feeding them and finding a meal that they like.
Yeah, that's a fairly common issue. This goes to the second part of the autism symptoms, which is the rigidity and inflexibility. So they like only a certain select type of food. So they might be very, and also around the sensory, because it might be around textures as well. So for many people on the spectrum, they only like a certain kind of food. They like to eat the same thing over and over and over again because they tend to be, they tend to repeat behaviors and they tend to be very rigid. And also the textures can be really annoying. So they might not like things that have a particular texture or a particular smell because of those sensory sensitivities. So sometimes that interferes with the food. So people on the spectrum have are very picky eaters, yes. And especially when they're younger. They might become less so as they're older, but particularly when they're younger, they tend to be very picky.
A follow-up question, Dr. Miller. Is it common that they throw up often? Children with autism?
I don't know one way or the other. I wouldn't say that in most of the people that I interview that comes up as a common symptom. That probably might be related to the eating. If they're very, if they're not eating certain things, or if they're, kind of sensitive around certain things. But I wouldn't say that a lot of parents report throwing up as a common feature. The picky eating, yes, but the throwing up, I wouldn't say is fairly common. Not that I have heard.
Thank you. Israel, this question is for you. What is your advice for parents who feel a little down, a little discouraged because they are learning that their child has got autism? It's coming from Jody and
Okay, I would say to them that, okay, so the one great quality that everyone who is a supporter, mom, friend, spouse of an autistic individual or child, patience. Oh, patience, because your child might not hit the milestone the same time as our next autistic individual, because each of us have a different limit. Because remember, I mentioned earlier, spectrum, somewhere else that you might fall under. So don't compare your child to anyone. Work with your kid. Do not compare your child or say that your child is the R word. Because remember, I told you, they said the same thing about me, and they still sometimes call me childish or mad or whatever. But that's why self-esteem is so important to build from an early age, like self-care, teaching them self-care, self-esteem, and danger. You can't go wrong there. Stranger danger.
Thank you, Israel. Dr. Miller, this one is for you. Do you have any tips for a child who's a picky eater and not even willing to try other food? Tavon sounds a little frustrated. He's asking, how will you ever know what the child like when you're not even willing to try any other food? Do you have any?
It's a hard one. What the thing that I like about what Israel said is the patience thing, which is necessary to deal with a lot of differences that your child might have. With the picky eating, patience, and it's a mixture of patience and really trying to work with your child. So like I said, if texture is the issue, it's really a lot of trial and error sometimes to kind of see. Typically what I say for parents is that what you want to do is try a very small portion, and try to get your child, just make it a routine that we have to have like maybe half teaspoon of something new, right? Even if you spit it out, that's fine. But what you want to do is kind of get them accustomed to trying something new. So the rule is every evening we have to try a half teaspoon of something. So you want to try something small and make it very consistent and see if they will get used to that. And then you kind of want to track to see, is it a texture issue? Is there some textures or some smells that will never work? And so I have to try these things. So a lot of it is trial and error. A lot of it is patience, trying very small amounts, being consistent. That's honestly for almost anything that you want to change. That's the rule of thumb. Small, consistent. When they're really young and you're worried about nutrition, you just have to hide. A good way is just to hide food hide nutritious foods in things that they eat is the other way to kind of get around it. It's frustrating, but patience.
Absolutely. Dr. Miller, just a comment here. I want you to confirm, or you're able to confirm that Nicole Walker, Mrs. Walker is asking, or she's saying that Michael Care will be having a session on picky eating this week. Is that correct?
I'm not sure. I can't say yes or no, to be honest. If you know what, I've been out of office for a couple of weeks, so if there've been emails sent around that, I might not know. So I don't want to say absolutely not. If you've heard that, then probably. I'm so sorry.
Is there a number she could call to confirm? If this is something.
Then the main number is 929-7720, and you can call that number to find out if there is a workshop being scheduled on picky eating.
Thank you. Mrs. Samuels?
Thank you. Yes, there's another question here I'm seeing from Shelby. It says, what can be done if the child gets this excess energy in the night and doesn't want to go to bed?
Wow. All the hard questions for Dr. You know what? I'm not so sure if I have an answer to that. And I wouldn't say that most children with autism, I wouldn't say that necessarily have. A lot of children with ADHD have a lot of excess energy at night. And I will probably just say consult with your pediatrician around that. I don't want to comment on what might be effective or not, but your pediatrician is probably a good source of help for trying to get them to sleep at night if that's an issue.
Thank you. And I see your comment, Yvonne. This is a 5-star event. Commendations to you, Mrs. Morris and team. Again, excellent job here. How are we looking at YouTube? Any questions from your end?
I am not seeing any more questions at this point.
On YouTube, rather. No more questions.
Mr. Russell, we did mention, I'm seeing a comment. Mr. Kane Russell is saying, what about the waiting list? Yes, we spoke to that earlier on, and unfortunately at this time, it's not something that we can resolve. It's not something that Dr. Miller and her team or coworkers are able to resolve at this point. Some other options were shared earlier on. I'm not sure if you are able to see or probably not see them in the chat. But what I'll do is try to type some on YouTube so that viewers over here can also see some of those other suggestions in terms of where else you can go to get these assessments done.
Miss Mullins here, she wants to find out, well, she has this concern. She takes her son everywhere, but he always acts as if he is in prison and always heading through the door as it opens. What are some suggestions? And I see Miss Israel there chuckling. What are some suggestions that you can provide for Miss Mullins as it relates to this observed in her child?
Okay, so if not Israel, I'm gonna invite Miss Williamson. Miss Williamson, are you still with us? Israel, would you like to take that, or should I pass it to Miss
So,
Williamson?
I have
Okay.
an advice. I do believe that autistic kids, especially young ones, I think that they can learn discipline because I try being a little bit stern with my niece because she does the same thing and even worse. So we try to balance the love with the discipline. They still can learn when there's something wrong. I can't say specifically to your son because I don't know his personality, but you do need help. So maybe you can't bring him everywhere with just you. Maybe you need someone else with you. Because it does take a whole, someone that can keep them one place that can hold them hands or something. And they do love to go out. That is just an advice based on my experience with my niece. Okay?
Thank you. Miss Williamson, are you still on? Miss Williamson?
She did say she actually had another meeting, so perhaps she had to leave at this point.
Okay, okay. Thank you, Mrs. Morris. All right, I'm looking through. All right, somebody said my son does this every day. Oh, do we have any support group for parents in the parish? Anyone would like to take that? A support group in our parish?
I don't know the actual, well, Michael Care has put on a number of workshops related to autism, and I know the parents that have attended that have created a support group. I can't say offhand how you access it, but and one way would be to call the center to see if they have links, but I know the parents that have attended some of the workshops have created a more informal kind of a support group. So that maybe is one source. I don't know about more formal support groups that exist.
All right, thank you. Thank you, Doc. This question was already addressed. Is vomiting common among students with or children with autism? I think that was already addressed. All right. Anything on YouTube land, Mrs. Morris?
No, no more questions at this point. I think we're gonna have to wrap this session in just about a minute. So we're calling to find out, or calling at you to find out if there are any other questions. Does anyone want to vocalize a question? We're not seeing any more in the chat.
Just something, Mrs. Morris, may I interject?
Absolutely.
I'd like to highlight Mullins here is saying she has a WhatsApp support group for parents with children who are autistic. All right, so perhaps we may want to get some more information, Mrs. Morris, and then of course we can send out that information.
Okay, I'm going to share my number in the chat.
Sure.
So that this information could be shared with me.
Doc, are you still on? I think we may want to touch on this. Is it true that medication during pregnancy can cause autism?
No, there's been no support for anything like that. Right now, the causes of autism is unknown, apart from I said that there's a genetic component, but there's no evidence at all that any medication pre or post pregnancy or in early development is a cause for autism.
Okay, thank you. Thank you so much.
Okay, and that is where we will have to wrap?
I would like to add something else. Could I add?
Yes, go ahead, Israel.
Okay, so it's not just autistic kids who have food intolerance and sensitivities, because even me myself, certain textures that's too harsh, certain smells, certain food, I still can't eat it. Like even with egg, I can't. I don't know, I just can't tolerate certain food, and I don't throw up a lot with certain food. So I try to have a food diary to say, okay, which food don't go well with my autism. So it's trial and error for me. So everyone in my life will notice I'm always changing my diet. I have to be very careful with food, not just clothes. I can't, even with gowns, whenever they give me sequins, them can't give me that. It scale up my skin. So they have to give me velvet and soft material. So everything is just particular to our genetic needs. So we just have to cater to our needs more. So that's what I would like to add. Do not force a child to eat food that they won't stomach, or if you see that they're pushing it up, your body is literally rejecting the food because it does not agree with our neurotype, guys. So that's just based on my experience.
Thank you.
Do we have a final giveaway, Mrs. Samuels?
Sure, we do. All right. Can someone explain to me the importance of integration? The importance of integration as it relates to children who are on the spectrum.
You want to break that down a little?
All right. Integration I mean, in terms of developing the social skills. Why is it important for us to include them into society so that they can, become functional beings? I think I'm giving away a bit of the answer in the explanation. Yes.
I'm going to take the best answer.
Yes.
I'm going to read them in your hearing and you'll be the judge. Yes, I've given you a little more difficult part. Forgive me. So Nakita Mullin says it is important for their growth and development. Valerie Brown, it teaches important life skills. I think they're being brief because, the line. Okay, Vinny says integration is important for growth and development plus emotional. Okay, so it's important for growth and development and emotional growth as well.
I think that's more comprehensive or the most comprehensive response, Mrs. Morris, coming from Venice.
All right. So, Venice, you know the drill. Unless there is someone else who wants to make an attempt, so we're taking the best and comprehensive comment. In fact, it builds self-confidence, says Mrs. Page.
Look at that.
Oh, Lord. Firstly, it promotes social skills development by providing opportunities for interaction and neurotypical peers, fostering communication, empathy, and understanding. Secondly, helps reduce stigma and misconceptions about autism by increasing awareness and acceptance among peers and the community. Additionally, integrated settings offer chances for skill generalization where children can apply learned skills in real-world context. No, Samantha. I agree with Venice. Venice is dying with laughter at your very comprehensive response. All right, I'll read one more and then I'm going to have Mrs. Samuels make a decision. It seems as if we're going to have to give at least 2 Mrs. Samuels.
Yes,
integration prepares children with autism for life beyond school by providing opportunities to navigate social situations, collaborate with others, and develop adaptive skills necessary for independent living and employment. I rest and I yield to you, Mrs. Samuels.
I think, Israel, can you help me be the judge for this one? I think Denique's comment was succinctly said. Israel, you want to help me out here? I am looking at 2 comments so far that I believe would have explained in depth the importance of integration.
Okay, so can I give my little insight? Okay, integration is really important because it is said that 80% of us won't be employed, and employment after adulthood is very important because our parents won't be here forever to take care of us. For me, I worry the most that I won't be able to live on my own. I'm not thinking that, because there's a lot of adults, autistic adults, that we're not able to live on our own. We need substantial support. Like even me on my pageant journey, sometimes I need a little bit help, but I do prefer to be more independent because I want to be an independent woman. However, it's also important for my confidence that I have female friendship, which is something that I would struggle with, because I go through interracial bullying. Even during pageants, the girls, they know that I'm different, and some of them, they don't talk to me, they treat me really different. So sometimes it really hurt my feelings. So that's why I have to find individuals like myself as well. So integration is not just about employment, it's about self-esteem, it's about building a community with women so we can have support for different genders. It's about learning about our health, mental, physical. It's about going to church, learning your different needs, interests, niche, because not all of us is going to be able to go to university or can afford it. Not every family will know the support. So integration also important for destigmatizing us, because I am tired of persons thinking that only males can have autism, and that because I'm well put together and I can speak fluent that, oh, you can't be autistic. It's about breaking the stereotype. For me, 100% it's important.
Wonderfully said. Wonderfully said. Beautifully said. Thank you so much for wrapping up so nicely. And so, Mrs. Morris, I think my winners are Denique and Samantha. So
very good. And Israel, I saw what you did there, Israel passed on the judgment era there. She passed.
Yes.
Very neat, Israel, but it's quite okay. Thank you for sharing that comment. And it's very important that you raise the concern of transitioning into the world of work. After school, what? And you raised another very important point. Your parents are not going to live forever. Your caregivers will not live forever. So what then? The charge is then on parents, on guardians to begin seeking from now services that will aid your child in being independent. And you need a plan for should your child outlive you. What's the plan? When your child leaves school that is so sheltered and there's a teacher's assistant, especially if they're in a special education setting. Some of them also have a shadow. So you have 3 adults giving you support in a space on a daily basis. But what happens after? This is a conversation you need to have with the transition personnel at your school. This is their job. You need to find out, can you help to guide me, or the guidance counselor? Can you help to guide me so that we can begin having this conversation as it relates to my career or my job when they leave school? What are they going to be doing? Can you point me to some places that could be helpful to them later on? Just want to read one comment, and then I'm going to be calling. We have been here for a while, and I know persons do not want to be here beyond 9 o'clock. Absolutely not. So we have completed our question and answer segments.
Mrs. Morris, before you go, just want to interject briefly. You made mention too about parents. I do believe too that some of our parents are in denial, and they prevent our children from being functional. And so most of them, you realize they experience what we know as learned helplessness. So because they want to do everything for the child, then of course you realize the child is not able to develop any sort of functional skills, right?
Great point. And we call that in the field the learned helplessness, correct? So you want your children to do what they can. So if they can dress themselves, allow them to dress themselves. If they can have a bath independently, allow them. Teach them how to, use the restroom independently, how to read signs and self-space is something that have to be taught to them. How close can you go to a person, or should you go to a person? You're not gonna go right up into their personal space. There's some distance that you need between you and the person you're addressing, maybe an arm's length apart, because that is what is socially accepted. And we did talk about social skills. We have to be intentional about what they're taught, about what they learn. We have to be very patient, as we've said over and over. They didn't get it today, try again tomorrow. You have to divide up whatever you're teaching them in chunks. You can't give them all of it at once, because then it will be overwhelming. All right. So I just wanted to read Mrs. Samuels' one comment from Carissa Francis. She also made an attempt at the question. I don't want to ignore my YouTube people over here, all 15 of them. They can function well in society. So we'll now take the closing remarks from Miss Grace White, and then very quickly following her is going to be Deacon Lindo, our president for the Family Life Ministry. Has been a very insightful evening, and although it will be officially done, I want to thank everyone for being here, all your participation, your comments in the chat, your questions that you vocalized, your being with us for the entire session. We're really grateful. If you were not here, we'd have no one to present to. Over to you, Miss Grace White, and then followed by our president, Mr. Lindo. Again, please wait to be unmuted by the host.
Go ahead. Good evening, everyone. Are you hearing me?
Yes, we are.
Okay, great. Thank you. Such a refreshing session that we had tonight. I wish that everyone would really use their emojis to give a clap hand to Mrs. Kimberly Morris and her co-moderator, Mrs. Knight Samuels, and the esteemed panelists tonight. What a refreshing session that was had here tonight. I'm sure that we all not only enjoyed the session, but I like to think of it in terms of being a refreshing session. And we are from a church, from the Lindsay Pentecostal Tabernacle, and to be refreshed really comes from a place of repentance, when you recognize that you're really not where you should be. And I'd love to put a spin on that tonight and say that I believe that the same can be said even for tonight, because many of us would have come with our preconceived notions about what autism is. And many of us, we have had our interactions with persons with autism in the past. And we know that some have gone well, some have gone not so well. Some of us have ignored situations where we could have been more assertive. And so tonight, really, it's a refreshing place to be more aware, more knowledgeable from this forum. And certainly we have all benefited. The plethora of questions really have brought out so much. I must really say that I really enjoyed Ms. Williamson's presentation, where really a lot came to life, even about, different from the definition of autism, that there's no known cause and no known cure. I've really never thought about autism in that way, because many of us believe that, there was a cure. And so tonight, I'm really grateful for that. I've never put into perspective, I know meltdowns happen, but I've never put into perspective the impact that they could have. And I'm really grateful for Miss Harrison's presentation. Big up, Miss Harrison. I'm so proud of you as a young woman of value, a beautiful young woman. Yes, and I'm blowing you a kiss also. Continue to really shine and to really, be that champion out there. I even from though I may have been exposed a bit even to information regarding autism, I really must confess that I didn't really understand that persons with autism don't really understand sarcasm. So certainly that is going to change my behavior towards persons with autism. Also from Dr. Miller's presentation regarding the Microcare Center, we really appreciated, where we were exposed that it's really a spectrum and that we shouldn't look at persons as being normal or non-normal, but really at the level that they are functioning along the spectrum. So I'm sure that that will overarching, as I said before, allow us to be more inclusive and have an integrational approach in terms of our interaction with persons with autism. And in terms of from our audience, I really liked Mrs. Faye Page's example of how she actually includes persons with autism in her classroom. I think that was really well. I'm sure that many persons benefited from that. And certainly we are thinking of different ways that we are going to change our perspective and ensure that we are more caring as a village. As Ms. Harrison says, that the world was not built for persons with autism, but indeed we can make the world a much more loving and lively place. I've never even really put into perspective that persons with autism will hear 10 times more or will visualize something 10 times more. And can you imagine if that's in a problematic situation, then the stress must even be magnified so much more. So tonight, I really believe that we are at a place of being so much more empowered. Really just wanna, I'm not doing the vote of thanks, but just wanna just mention that those areas really jumped out. And so we are really refreshed for persons with autism, just looking at the fact that, they really have to chart those milestones. And when they achieve those milestones that they are celebrated is something that we should really try to even emulate. And also the fact that we should try to do things in a small and consistent manner, I think will definitely put us all as humans, as individuals, in a better place, because at times we may chunk off a lot or we think we know a lot, but just starting small and being consistent is definitely the way to go. And so certainly, on behalf of the Linstead Pentecostal Tabernacle Family Life Ministries and being a part of the audience tonight, it was certainly, Mrs. Kimberly Morris, a refreshing experience. Thanks to you and your team. Over back to you.
Thank you, Mr. Lindo. Let's just bear with him as he waits to be unmuted or get the opportunity to be unmuted.
And go ahead. So Linda, you can unmute and go ahead. So Linda, you are free to unmute and speak.
Okay, they seem to be having a challenge on their end. May I invite, or Bishop, I know he addressed us earlier on. I think he's still here. Bishop, at this point, I'm asking if you have a final comment that you'd like to make. Bishop Otto. And I'm sure that he will need the opportunity to be unmuted as well.
You can go ahead.
You may unmute, sir, if you so choose to make a comment.
I'm not seeing him in the list of participants.
Okay. All right, not hearing from the Lindos either. Let me again thank you all very much. I want to pause also to acknowledge the other members of the Family Life Ministry. I did not do this by myself. I had a team of persons giving me support. We had Deacon Lindo, president, as I said before, his wife, Missionary Lindo, who works very closely with him, Brother Elon Clark, Brother Don Lewis, Grace White, Kimon Fraser, Yvonne Campbell, Paula Bonner, and also Sheila Clark. Thank you all for the support that you gave. Thank you everyone for being here with us. Feel free to greet someone. Mr. Simpson, are you able to just give everybody the opportunity to unmute and make a comment verbally if they wish to? And then we'll be off in about 2 minutes. Thanks again, everyone, and good evening.
Yes, you are free to unmute.
Very good, Sister Kay.